Hey everyone, it's Dr. Charlotte Hodges, and I wanted to continue my series of what to expect today. Today we're going to do part 4, what to expect week 2 after surgery. And if you guys have been following along, you'll probably notice that I'm getting a little clammier and clammier. I'm taping this entire series at the same time. And so with each progressive video, I've gone further and further in my walk, and I'm probably getting pantier and pantier. So, is that a word? Anyway, I'm panting more. Maybe I should say that. So, what to expect week 2. We're just crossing the street. So, by week 2, this is whenever you can start your full liquid diet. It is the exact same diet that you did preoperatively. Generally, by the end of week 2, you're tolerating a full shake and you're starting to get in your second one. And again, when I say shake, I don't mean it has to be this great big frothy thing from Smoothie King. All I mean is your protein supplement. If you want to make a shake, great. If you want to do a little protein shot with Gene Pro or with the Doc Hale Nutrition, by all means, do that too. But generally, you're able to tolerate 1 to 1.5 shakes or protein supplements by the end of week 2, and that really should be what your goal is. Week 2, again, you can use straws. Week 2, you can do any thickened liquid, nothing with lumps or bumps. So that will be cream-based soups, tomato soup. If you like broccoli cheese soup, stick it in a blender, make sure it's well blended. If you like clam chowder, stick it in a blender, make sure it's well blended. As long as the soup is blended and there's no lumps or bumps, then you can have it. I don't mind if you use a straw. I also don't mind if you have coffee or tea that has caffeine. The only thing that caffeine can really do is it can give you an upset stomach. It can be sometimes irritating after surgery. For most people though, there has been kind of an old wives' tale that says that caffeine, if you have your cup of coffee after surgery, then it will dehydrate you. But the reality is that if you're having the same amount of coffee that you typically would, your body's probably already built up a bit of a tolerance, so it's not going to have a huge diuretic effect. Now, if you were to sit down and drink a whole pot, then yes, you'll probably get a little dehydrated. But if you're used to having your morning Joe, go for it. I don't care. I think one other side note to know is at this point, you're going to be sick and tired of liquids. At this point, when you call my office and say, can you do something where you chew it? I will always emphatically, and so will my staff, tell you no. No chips, no crackers. You can't soak your crackers in your soup. It all needs to be a liquid. Period. End of story. I'm telling you right now. Typically, if a patient begins to advance their diet too soon, and this is what I hear, well, I tried it and it went down fine that one time. What happens is that you are stretching that staple line, and then as it heals, it could break up some of the permanent bonds, and so you have a really big chance of things scarring in. And I will tell you, typically, if a patient is going to present with a stricture, I'm trying to get the sun out of my face, sorry. If you're going to present with a stricture, it's usually at the 3 to 4 month mark, and 9 times out of 10, it's because week 1 or 2, you tried to eat something that you were not supposed to. And it's pretty rare, unless somebody is profoundly anemic, but we certainly try to address that prior to surgery. If you have had a revision, there is a slightly higher risk of chance for stricture, but the vast majority of the time, strictures are patient-induced. Also, during this time, and after surgery, forever and ever amen, no tobacco, no NSAIDs, and no steroids. Period. If you have any questions, call the office. I think one other thing to note is definitely by the end of week 2, you clearly should be staying hydrated. and you definitely should be almost to goal. Well, at least very close to goal with your protein. If you have not done any protein by the end of week 2, I will tell you, you will start getting very nauseated. What can also happen is it may feel like things aren't going down. And for me, whenever I see you at your 3-week follow-up, it can sometimes be difficult for me to discern, do you have the beginnings of a stricture, or is it just because you're non-compliant? And so depending on your evaluation by me, it might end up buying you an EGD so I can evaluate your anatomy. So certainly, I want you to work on your protein. Pardon me. I don't care what form of protein it comes in. It just needs to be in a liquid form for week 2. Okay? So, but you can get creative. You can spice it up, zhuzh it up, however you like. Okay? So I hope that this has been helpful. What I'm going to try to do is make some little tasty recipes. That way you can see all the different things that you can do for weeks 1 and 2. So stay tuned for that as well. Hope that you guys found this helpful. Give me a thumbs up and don't forget to subscribe. Oh, and please, please, please share this with your friends and refer back to it if you have any questions.